You know how I look like in this morning? It's 5:37 a.m. So I just want to give you an update. Yeah, the second opinion appointment was canceled yesterday. They contacted me and said, look, if you haven't got the bone marrow biopsy result, then we will have to move it to next week, which is kind of fair enough. So it's 19th May at 4:30 p.m. Via telephone appointment. Regarding about the eye that I asked about you guys earlier, yeah, so I have appointment with the GP on 19th May as well, face-to-face appointment. So it's not telephone appointment. That's on Tuesday as well. Okay, Monday obviously diagnosis day. Let's bring this on. Let's just get it on and let's just do it. Let's just kick this cancer's butt and let's just do it, guys. Like literally at this point I'm so tired. Currently what I'm dealing with is because I woke up with some pain in my neck, in my whole body. I was thinking, what happened to my body? Someone has hammered it, or what's going on? Then I get to know it's called steroids flare up. So basically, when you're actually done with the dose, 14 days of steroids, you get that flare up basically. And actually, yes, it means that the steroids is actually working, which is a great news because I guess I had so much inflammation in my body that it has suppressed my immune system. Obviously, that's why I had UT infection for inflammation. Due to the steroids, I had UT infection, and I have actually completed my 5 days course, but they said it's 7 days course. And I'm like, no, you said a 5 days course. That's what the doctor said. The pharmacy said, no, it's 7 days. So I don't know, really. I mean, I can see the NHS app, everything clear, like what they have wrote in the documents and everything. So that's what I'm trying to say. Sometimes you can see about your blood test on NHS app, but you have to let the consultant know if they can actually add it on to it. Sometimes they don't do it. Basically, I attended to a webinar as well 2 days ago regarding about bone marrow biopsy result and everything, how WM is diagnosed, just to get more a bit knowledge, because I think it came in the right time, alhamdulillah, basically due to Allah. The email just comes in the right time and everything's written, right? Second of all, I just want to mention, when you actually talk about someone, especially brothers and sisters, I just have to mention this now because I really have seen it. So many people are doing it. Khadija, you're talking about her. You're not talking to her. I mean, there's two different things when we actually challenge people or judge people. I mean, it's about her, right? I mean, isn't it best that she any clear rumors, she clears the rumors, and it's about her, then she would have to say it instead of you say it. What it is that we tend to judge people, and then suddenly all the misunderstandings and everything, and the people have been doing this to me, and I don't really appreciate that at all. I mean, I'm a very straightforward person, obviously. That's why people don't like me being so straightforward on their face, but this is who I am. I like to share, not AI, I like to share myself, you know what I mean, and just be realistic what's happening in my lens, in my what I see a vision. I also think this has helped me a lot. Now, this is the Nightbird project. I becoming new person, and I, of course, ignore how my hijab is looking. I'm not perfect Muslim just because I wear hijab, and a lot of people have commented on the video on the live stream about my hijab is not looking good, blah blah blah. There's something going on, racism and everything, and I think TikTok should not allow these kind of comments coming on my live stream. It would be great if you can have that feature to block it off instead of just blocking a normal conversation and that the other person has not offended me. You know what I mean? Yeah, okay, thank you. And then I have notebook that I've been writing down. I think this has helped me a lot, especially when I forget things. I am planning to do merch, but I don't know when, but I think maybe a notebook would be something. And it's going to call Be Kind, Be Humble. I really want to have these two words because I think, because Allah's kind, Allah's humble, that's why. And Allah's the one who gave me the idea. By the way, I also bought from the Dr. Kersh's hospice. I like to support them, and I also bought this. I think it's more like a calendar or something, calendar, yeah, more calendar, so I can write the dates. So yes, I do have ENT appointment this Thursday as well. I mean, for me, it's like just get on with it, and I really don't really mind. Do you know what I mean? I don't really mind. Just get on with it, honestly. So I thought I'd just give you a quick update about it. And yes, on Saturday I need to go to this one, and there's only 5 sessions total, and we do get buffet. It's amazing. I think they have helped me to become a more positive person, which is crazy. I was thinking what happened to me yesterday because I felt like so depression, and I'm thinking I have a great mood when I was on steroids, and obviously it had side effects like brain fog and not able to sleep. Now I'm seeing there is stiffness going on, so I don't know how long this is going to be, but I have written to my CNOs early in the morning, is this normal to have bone pain stiffness after the steroids taking? Because then I can know, so I can get the knowledge, because sometimes we don't have that knowledge, and we do ask our CNOs, and in CNOs it's the job whether they can answer or not, because they're the one who gave me steroids, not my doctor, if that makes sense. Anything that someone has actually given, you need to ask them, basically. So anything you have question, ask. But coming to someone's judgment and everything, you ask the person who you have issue with. That's what I have learned this year. Alhamdulillah, the strength that I'm getting it from Allah, basically. Yes, it's not easy to be a cancer patient. Let's just be very honest. I'm already dealing with so many things, difficulties with people, difficulties how do I need to speak. People are saying, it's your battle. You need to go and pick up your battle. I could see that. I am literally battling this every single day. This cancer and the people every single day. But I am very confrontable, basically. Like, so if I have an issue with you, I will go to you and ask, what's wrong? What's going on? Yeah, exactly. That's exactly I've been doing this year. So I think I've changed this new me, and which is great. Sometimes it's not great for other people thinking, who is she? Exactly. But rumors are not facts. AI is not real.